the Aboriginal Health Medical Research Council conference, and you've just really blown everybody away with your story, which leads, after a while, to training at the Australian Indigenous Marathon Foundation with Robert D. Costello. But it's a long story that's got you there. You talked about that you had many struggles leading up to that. Can you talk a little bit about what you told us there?
Yeah, just with everything that's going on, in my personal life, I needed something to to keep me going in life, for my children. And with me not having my enough confidence in myself and not with low self-esteem, I needed to push myself more. So I signed up for the Indigenous Marathon Foundation, and with me being in the foundation, it really built my confidence.
Can we go back a little bit more, because you wouldn't have said that you were a fitness freak before then, right?
Oh yeah.
Tell me a bit about.
Yeah, I was overweight, and I struggled a lot with eating healthy. And I was a smoker, I was a drinker, but all of that needed to change.
And you did. So what got you from one bit of doing that to actually joining up with the Indigenous Marathon Foundation?
What I did is I needed to set myself a goal. And I wasn't sure what it was until I found something in the Koori Mail, which said once in a lifetime opportunity chance to run the New York Marathon. So I was thinking maybe this will change my life. So I applied for it, and I went to the trials in Coffs Harbour, and I ended up getting selected for the team.
Now, you had run marathons before by that stage, yeah?
No, I had not run any marathons at all.
How far had you run by that stage? What was the longest?
No more than 2.5 Ks. And I also went to Canberra and did the 21K with no training at all. I also ran, I came last. Like I was getting really bad cramps and wasn't even expecting anything, and yeah, I came last, but I was happy with myself that I finished it.
And that was your first ever marathon?
That was my first ever half marathon.
So let's jump forward, and you ended up running in New York. What was that like? How hard was it, and how amazing was it?
Oh my God, the New York Marathon. Trained really, really hard for it. I was really confident in myself running the New York Marathon, because I went there for a reason, and just the emotional thing that's going through your body, and all the pain and everything that I experienced running the marathon. It was unbelievable.
It was incredible to see the pictures of you at the end. You were in tears.
Yes.
You don't just walk away from those things.
No. The tears were joy. Joy and proud of myself for finishing and completing the New York Marathon. Not only for myself, but for my kids, my family, and everyone else who had supported me, especially my partner.
What's it meant to them that you did that?
Hopefully that it changed it. Like it'll teach them to maybe try to change their lives as well. So.
You said you wanted it to be life-changing for you, and I think it has been. But you said you've just started work as an Aboriginal health worker. You said that was your first job in many years. Yes, I have. The last time I worked was when I was 18, and now I'm 31, and I've got my first job, which is at Walgett Aboriginal Medical Service. It was a big move, and I moved out to Walgett because it was something different.
I've always said to myself, if I was able to get a job, I'd like to start in a remote community, in something small, and then maybe work my way up.
And what do you think, having the experience you've had, what does that give you as a health worker? You know, not only the struggles you faced yourself, but also getting through to be a marathon runner. How does that help you in your work?
I really didn't know much about being fit, being healthy, about being, you know, an Aboriginal health worker. I only just realised what I wanted to do in my life only last year. Like, yeah, it took me a really long time to find out what I wanted to do with my life. So.
And what is it?
To be the Aboriginal health worker, and also to be a marathoner as well.
And you're keeping going with marathon running?
Yes, for sure.
What's the hardest thing about doing it?
The hardest thing about doing it is just keep being motivated. It's really hard. Like I have been struggling with anxiety, depression, you know, and all that. And it has been putting negative thoughts in my mind. But you just got to keep being positive and just keep going forward.
You said too, with things like you were a smoker, and to give up smoking, you had to distance yourself a little bit from family and friends.
Yes.
Can you talk about that? Because we're at this conference where we're talking about trying to tackle tobacco use in Aboriginal communities.
Yeah. You know, I had to quit smoking. Because I knew I had to do it. Not only you know, for myself, but for my family as well. My kids. Yeah, it's really hard when you know, when your whole family smokes. So you're gonna have to, you know, do something, and you know, you're gonna have to distance yourself sometimes to get to leave it.
And that's what you did. You said you still kept going around there, but you wouldn't stay around as long.
Yeah. That
kind of thing. And did that eventually it worked for you?
Yeah. Yeah. I could be around them today and not even care. Like I can't even stand the smell of smokes anymore.
And do you think has what you've done inspired others in your family and community?
Yes.
In what ways?
My sister's been wanting to do start running as well. My brother. Yeah. I think a lot of my family has been wanting to change. You know, but it's all they're gonna always have that negative, you know, thought tell them that they're not good enough to change. But you know, if you believe that you can change, you know, you can. So.
And what do you think it was in you that could do it, and out of you? Like, what was there something within yourself, but also support externally that helped you?
I had a lot of things going through my mind that I need to change, my life, and within myself I know I have the confidence, not the confidence, but the willpower to keep me going. My family was great in supporting me with my journey. I think when I get into doing something, I focus into completing it. So. And
what's the next challenge for you?
My next challenge now is to you know, starting off again and just making my way up. Because in the last few weeks I had been struggling, but I've now got to start all over again and just push my way up again.
With training for running,
Yeah,
you
with
mean?
training. Yeah.
What do you ultimately need to do training wise to? And are you heading for New York again or what?
No, not yet. Not yet. Maybe do the Gold Coast half. Come back down to City to surf. Yeah. Just see what happens.
And people always talk about breaking through the pain barrier with a marathon. Do you?
I
What
love
does it
the
feel
pain.
like?
I love the pain.
Really?
Yeah.
Why?
I don't know. I just love it. Can't explain it, but I love the pain.
What does it feel like though?
It's sore.
Yeah.
But with the pain, I know that I've done something. I've trained hard.
That's fantastic. Thank you very much,
No
Eileen.
worries.
Congratulations.
Thank you.